So when should a student get in touch with wellbeing or the mental health services at their university?
So it depends what situation that student's in. Like I say, if they know that they are already diagnosed with a mental health difficulty, they want to get in touch really as early as possible, and even filling out their prospective student forms, it does ask about disability, and mental health problems do come under that. So they can fill that out, and then they'd be directed to the Access Centre for an assessment and potential DSA funding. So then we'd already know about them and can offer support straight away. So for students that know they have a diagnosed mental health difficulty, that's really important at the point of applying. And a lot of students think that they don't want to do that because university is like a fresh slate and it's a fresh start, which is really understandable. But it's also a really, really stressful time, and it's a big change and transition. And actually for somebody that has any kind of difficulties with mental health, actually that can be a really unsettling time, and probably better to try and get that support in place, even if it's not needed, which hopefully it's not, but at least it's there then if they do need that support.
And then during the degree, when should people get in contact with wellbeing if they feel like they might be struggling?
Well, we're here throughout the year. During term time is obviously our busiest time, but we do have staff here through the holiday times as well. So really there's no time not to get in contact, basically, if anybody thinks that they are kind of really struggling. And like I say, it might just be a matter of coming in and having a single session with somebody, because what we do here at Exeter, which may vary from university to university, is we don't just offer kind of counselling or cognitive behavioural therapy. If somebody's just struggling and they feel like they just need to see someone, but they don't quite need counselling, we do just have a single session available, which is like an intervention in itself. Or maybe just come in and have a workshop, which is just a couple of hours to get some more strategies or techniques that you can apply, again, to kind of manage that problem before it feels like it gets out of hand or too difficult. So I'd say get in contact at any point throughout the year things become too difficult to feel like you can manage. It's very difficult to tear yourself away from revision when there's so much to do, but good advice really is to try and, if you have a schedule and you have time frames mapped out of when you want to be studying, try and include in that schedule things like